being licked in the face, diarrhea on your boots, slapped in the face with a Euroseptic Foley, slapped in the face with a dick. A very large dick. Which of those four would you rather have done to you? Welcome back, everybody. Today, we will be reading real healthcare worker rookie mistakes submitted by healthcare workers at my comedy shows, which you should definitely go to. We're student nurses in the ER and a guy cut his wrist and he wouldn't stop bleeding and they had it wrapped up. We went in with the doctor to assess it and he unwrapped the guy's wrist and blood squirted out and my friend said, uh-oh, we're in the splash zone. It was just dead quiet in there afterwards, man. You gotta read the room. Okay? It's not that it's not okay to say things like that because you can joke in the ER. This is something I would say, but you really gotta make sure everybody's cool with it too, you know? Not the worst thing he could have said. It's not like he said, sir, your bleeding is causing a mess. You need to stop that immediately. That is not okay to say.
The first medication is the rash ointment for the yeast infection that you have on your butt. Does that sound right? Perfect. And then we have these capsules. Take 3 tablets twice daily for your crippling depression. I also have the antibiotics for the chlamydia. Man, it just keeps coming back, doesn't it? You must be popular. And it also looks like we have something for your anxiety. Do you want me to refill that or do you really need it? I mean, anxiety is not something that happens like every single day. Do you still have it? Do you still get anxiety? Do you want me to refill it? Are you unsure? Okay, we'll circle back to that one. And you know, I thought that you looked like you had lost some weight. Do you want to refill your Ozempic? Yes? Okay, perfect. And it also looks like you have 2 acne prescriptions. I'm just confused why that is. Oh, I see. One is for your face and one is for your back acne. Perfect. So I'll just have you sign here and you can be on your way.
Oh my god. Okay, yeah, so this is a good example of what not to do when discharging your patient, not screaming about the patient's chlamydia medication for the entire hospital to hear. I was working with a first-year student on their first rotation. They were helping a patient walk and had been so nervous, I'd given them such a big pep talk about how the patient would be great and they'd be fine. After they help the patient to stand, the patient leans over and licks the student, full drool in effect from jaw to hairline. Oh my god, that's a lot of licking. The student practically goes into shock. I have to step in fast, definitely behind the patient to avoid more licking as he kept trying to lick us to get him back down. Ah yes, sacrifice the student nurse first. You yourself should stay out of the line of fire. I just remember trying to debrief the poor student and do damage control and trying to think of how we were going to clean her. Get a little soap and water and rub it off. It's not that bad. Get back to work. I have never had anybody lick my face. I'd be more upset if the patient bit me, but a lick? Come on. You wipe that off and you get right back to work, okay? I once had a patient's blood splattered on my face. I can't remember what happened. I think I was holding down a patient's arm for the nurse to mess with the IV and blood splashed onto my face. Wiped it off and got back to work.
I'm a professional.
What is the biggest bone in the body?
Skin.
No. That's the biggest organ.
The biggest bone in the body is not your skin. That is the biggest organ in your body. But she panicked.
Oh.
The femur.
Point to your
The
carotid
femur.
pulse. With your hand, can you put, what is supine position?
Supine.
Supine on my spine.
Supine is when you're laying down and you're facing up.
What is semi-Fowler's position?
Semi-Fowler's.
It's like a
Ooh.
reclined chair, like a lazy boy. What is the range for a normal pulse?
Number 60 to 100.
What about normal respirations?
12 to 20.
This girl in the middle is killing me. I would trust her the least. She's trying her best. I could tell, but goddamn girl.
Blood cells in the body fight infection.
White blood cells.
All right. Good job, guys. Good job, good job.
I would definitely trust the blonde girl with my life. As a provider, NP in the emergency department, that is a nurse practitioner, in the emergency department doing a pelvic exam, but because the lady was on the larger side, missed the vagina twice, and she said, wrong hole again. Come on. We've all been there, fellas. If you don't work in healthcare, you don't know. Okay? It's very hard to see what's going on down there. It's usually not that hard to find the vagina. It's usually harder to find the urethra. If you don't know, women have 3 holes. Men have 2. We each have a urethra, which the pee comes out of, and a hole in the bum, where the poop comes out of. A woman also has an extra hole called the vagina. Vagina typically is the easier one to find.
Clark, what do you say we get you out of here today, huh? We're gonna discharge you and put you right into hospice. There's nothing more we can do.
That is not the way to tell somebody that they're in hospice. You don't walk in there with a smile on your face.
How you feeling, Gerlina? Good? Great. Well, it's not looking good. What's that behind your ear? Is that a quarter? No, it's a malignant cyst. I'm so sorry. Coming in with a smile on my face and a heavy heart. Unfortunately, look, there's no easy way to say this, okay? Escitalopram? Escitalopram? God, I can never get it right. Ugh.
Oh, this guy's so stupid. This is hilarious.
What's your zodiac sign? Cancer? Ah, fun. Well, speaking of, 7 swans are swimming, 6 geese are laying, 5 days to live. Unfortunately, you are totally fine, is what I hopefully will be saying in a year if you beat this thing.
Oh my god.
Oh my god. It's been your birthday this whole time and you haven't said anything? Happy birthday! Ah, it's just a cold, by the way, okay? Great, okay, we're just gonna monitor you overnight and then you're free to stay here for another 6 to 8 months. It is the worst case scenario. Are you familiar with coronary heart disease? Okay, well don't get too familiar. It's just heartburn, girl. You're good. Good news or bad news first? Good, we have Jell-O downstairs. Huh? How about that? And the bad news is you can't have any, we have to remove your throat.
We have to remove your throat? Come on, that's not real. This is not the way to do anything in the hospital. Whatever he's doing, do the opposite. We had an ER tech literally shit himself while doing CPR. It smelled horrible and we were all gagging. He was yelling, "Look out, code brown, bitches," every time someone had to walk behind him. Patient survived, but the tech's dignity did not. It sounds like the tech's dignity did just fine. It doesn't sound like he was embarrassed at all. If this is what it takes to save a patient's life in the ER, the smell has probably woke the patient up, honestly. I've sweated a lot during CPR because it is a very physical activity, so make sure to stretch your triceps before you start doing CPR and wear a diaper. Fentanyl patches. It's a patch you put on a patient's body when they're in pain. It's fentanyl. You know, it's not super dangerous if it's used in the hospital and used in a way where it's like controlled, right? But yeah, you should definitely keep your gloves on when taking the fentanyl patch off because there can still be fentanyl on the patch, and fentanyl will make you look like this. My preceptor accidentally slapped my forehead with uroseptic vagina juice during a Foley. Oh my god, how? She laughed so hard she cried. I just regular cried. Well, this is absolutely disgusting. And this is much worse than getting licked in the face by a patient. Urosepsis is a UTI, which is an infection in the urethra that has gone on for too long, and the infection is now spread to the rest of your body. And if you've ever had to smell an infection in the genital area of a woman, it smells terrible.
Man.
You know, uroseptic vagina juice would make for a great name for a punk band. We are the uroseptic vagina juices! Good night! Yes. This has all happened to us. If your patient is NPO, that means they cannot have anything to eat, nothing per oral, because they are probably going to have surgery very soon. And when you have surgery, you want your body to be clean, empty of any food, things to come back up. It can go into your throat, you could aspirate, you could die. If you do eat before a surgery and you have a surgery scheduled, they will reschedule it and you will be there for a very long time, which nobody wants. We're not trying to be mean, we're just trying to be safe. EMT here had a frequent flyer at a nursing home who was definitely not fun-sized. Oh, here's another big one. He was complaining of abdominal pain with the craps. When we started moving him, I noticed a towel stuck to his bottom. I grabbed it when he sat down on the cot. Turns out that he shoved it up his butt to stop the diarrhea from leaking out. A fact I realized too late after the cot and my boots were painted brown. He then asked me to replace it. Definitely a shitty situation. Again, so many things worse than being licked in the face by a patient. And knowing this nursing home, that towel was probably being used again. They did not throw that out. Someone's probably using it to wipe their face right now.
Não é pra parar. Alguém aprende com ele pra revezar.
Segura a mão dele aqui, gente.
Não para.
My God, are they doing CPR on a guy who is still effing moving? And he's pushing hard on this chest too.
Learning CPR is vital to help save somebody's life in the event that their heart stops. However, one important piece of advice when you're performing CPR, if the person is fighting you and pushing you away, that means they are alive and do not need CPR.
They're trying to bag valve him too. What is happening? This has got to be like a simulation, right? Sir, this would be a lot easier if you would just hold still. Sir, their heart is pumping just fine. I had a patient brought into the ER by state troopers. She was under arrest. I told them that I was not going to watch her or chase her if she tried to run, so they needed to stay in the room. The off-duty officer at the hospital said that he would watch her so the trooper could leave. We already know how this is going to end. While the off-duty officer was watching her, the patient managed to pick the lock on the handcuffs off the bed and escaped while she had the officer go get her water. The old, "can you go get me some water" trick. I would say he messed up, but she was handcuffed to the bed. How did she pick the lock? All right, rookies, never leave an arrested patient alone in the room, even if they are handcuffed to the bed, apparently. Worked as STD nurse and patient complaint was pimple on head. Was examining his penis and searching everywhere and couldn't find it. Frustrated, I finally asked him to point to the pimple and he pointed to his forehead. Whose fault is this? Really? It is an STD nurse, so you're really only looking at one place. Although after the first few goes at his penis, you would think the patient would be like, you could stop touching that now. That's not what I came in for. Try to put a catheter in the clitoris. We talked about this already. It is very hard to find a urethra in a woman. You guys probably don't know this, but in the hospital, whenever we're trying to stick a Foley catheter in the woman's urethra, many times they will miss and go into the vagina. If urine doesn't immediately come out of that catheter and into our little baggie, we know we've hit the wrong spot because we know your bladder's full, so they'll pull it out and try it again. Ding, 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 until we get it. But this is common. That is quite embarrassing. Tie those scrubs together, boys and girls. Said big pinch to my quadriplegic patient. Chances are he says that for most patients and it was just kind of a reflex and he forgot his patient probably does not care about a big pinch. We were doing a 360 spine procedure when we flipped the patient. The very well endowed man slapped the nurse in the face with his dick. Your face should never be that close to the patient's dick. Also, I hope they put that in the report. Very well endowed man slapped me in the face with his giant cock. I feel like you should deserve some PTO for that. Take the day off, man. Of all the things that we've had so far, being licked in the face, diarrhea on your boots, slapped in the face with a uroseptic Foley, slapped in the face with a dick, a very large dick. Which of those four would you rather have done to you? And which of those four would you least want to be done to you? I'm okay with being licked. I would definitely not want uroseptic vagina juice. I don't want that on my face. Dick on my face, I can handle. I've done it before. Thank you everybody for watching. I am currently on tour right now. Dates and ticket links are in my bios. I hope to see you all soon. Goodbye, motherfuckers.